going to talk a little health news for you today. We have got Dr. Nathan Weller here. He's a clinic director with Restore Wellness. Nice to have you on the show.
Nice to be here.
We're going to get a little bit deep today. We're talking about stem cell therapy for treating neuropathy, which is kind of a big topic. A lot of people were talking about stem cell for the last several years. A lot of things have come out in it. So you're a busy man with it right now.
I am, yeah. Gosh, we're helping a lot of people and getting a lot of people through the clinic, and that's why I'm on here. We want to get even more people through to get people some help for this condition, neuropathy.
Right. So let's tell everyone a little bit first and foremost what neuropathy is.
So neuropathy is numbness, tingling, burning, sharp pains in the feet, legs, hands, and arms. A lot of patients have balance issues, cramping at night. It's hard to walk, just terrible.
Yeah.
And unfortunately, the standard of care out there is just to treat it with medications, gabapentin, Neurontin, Lyrica, different meds that just mask the symptoms and don't actually fix the cause of it. And that's where we come in.
So instead of putting a Band-Aid on it, you're actually going to the source, figuring out what you can do to fix it so people won't have to worry about that pain and be addicted to the medication.
Exactly. I mean, there's so much opioid addiction and Vicodin and Norco and all these things out there, and now there's finally an option where they don't have to just drug themselves and mask the symptoms, they could fix it.
Right.
That's where the stem cells come in. So the stem cell therapy we do in the office for it helps to actually regenerate the tissue, the nerve, the blood flow, get some more blood and oxygen to the feet and legs, to the hands, to the arms. And it's just we've been seeing amazing results with it.
So when you say this is affecting people, are we talking about people who are more mature in age, or is this the whole gamut? Young people as well?
Some. Depends on the cause of it. There's over 100 different causes that comes through the clinic, and majority of them have diabetes or even just old age, poor circulation, heart issues, post-chemotherapy. The average age we see is between 65 to 85 years old coming through the clinic, so it's a bit later in life. And we want to give those patients a better quality of life, instead of retiring and sitting on the couch in pain.
Being miserable.
Right. We want them on the cruise ship or on the golf course or on the tennis court or playing with the grandkids, going to Disneyland, just having a good time,
And you say you want your patients, because this is your motto, you want your patients to feel that relief without being on medications or the use of drugs. So when they hear that you can help them without having to have a prescription and go pick it up maybe every month or every week, how does that make them feel? I
mean, they're just elated.
Yeah.
Their face lights up when they finally realize there's another option outside of drugs or surgery. And to be able to do it without side effects, to be able to enhance the body's ability to heal and start seeing results within days, weeks, as opposed to old therapies used to take years to regenerate these tissues. We're seeing it sometimes overnight.
When you say stem cells, a lot of people are confused about this. So where do the stem cells come from?
There's a big misconception on this, and everyone thinks of the ethical issue from the old with the fetuses and whatnot. These come from the afterbirth, so the placental tissue, the cord blood, the cord tissue. There's no ethical issue with this. It's all from consenting mothers, and it's cryogenically preserved until we need to put it into the patient, and FDA regulated, safe as can be. Haven't had one adverse reaction in 10 years. We've done over 15,000 successful treatments. It's working well.
And how does the procedure work, and how long is it, and when do they feel the results of feeling better again?
That's a good question. So everyone's different.
Okay.
It depends on the stage that they're in, and we want people to come in early. If you just have a numb toe, or it's just starting in the calf, or it's just starting to go from your back down your leg, that's the best time to come in. And we're offering today a free consultation to give an exam and a history, see if we can help them or not. Some patients, they wait too long and it goes to a spot where we can't help them. So we want them coming in as early as possible.
And that was for the first 25 callers that receive a free exam consultation and nerve damage screening with you, correct?
Correct. And also, I just finished a new book on how to restore nerve and joint damage without the use of drugs or surgery. And I'm going to be giving a free copy of this to anybody that comes in from this show.
This is fantastic. So make sure you go to the website. It's restorenervehealth.com. You can also find a link on our website, aztv.com. Dr. Weller, you were fantastic. I wish we had more time. It's pretty fascinating stuff.
Yes, thank you for having me on.
You got your work cut out for you. Keep doing what you're doing.
I'm ready to help.
We'll be back with more.